The new medical treatments for obesity is going to revolutionize how we approach this disease. We now have medications that can deliver 10 or 15% weight loss on average. Again, important to note that these are not weight loss drugs. They are anti-obesity drugs. And what we now hear when we use these medications is patients come back to us and they say, this is so easy because for the first time, I'm not thinking about food. I'm not hungry. When I eat food, I feel satisfied. The medication that is the most interesting at the minute is an injection that we can use once a week to treat obesity. Patients use these injections themselves, and it hurts about as much as taking your nail and scratching it on your skin. But 1 in 2 people will have significant increases in satiety, in fullness, and reductions in hunger, and may lose 15% of their body weight. The medications have side effects, but they are normally mild and moderate, and people can manage them quite easily. And these can include feeling nauseous, but the nausea settles down. Other people may have constipation, and again, we can manage this quite easily with lifestyle treatments. And finally, anything that makes you lose weight can cause gallstones. And this is a small risk. 3 in 100 people may get gallstones. We also have other treatments called Mysimba. These are tablets that we take first thing in the morning and at midday. And what they do is they make people feel less hungry because they treat the disease in the middle part of the brain where the disease is situated. We can see about 1 in 3 people responding to these treatments, and they lose at least 10% of their weight. Again, with these medications have side effects, nausea being the most common, again, mostly mild and settles down. Other people can have insomnia, and therefore we only take the medications first thing in the morning and at midday, never in the afternoon or the evening. Now, people who have epilepsy can't take this medication because it can cause convulsions. And finally, we have a medication, an older medication called Orlistat. This is a medication that only works in the gut. It's not absorbed into the bloodstream, and therefore it has 0 side effects. But the effects of the medication is it blocks 1/3 of the fat that we eat. So if we eat a large amount of fat, that fat will come out the back passage and will cause terrible diarrhea, but you won't lose any weight because the majority of the fat is still absorbed into the bloodstream. However, if we help you and reduce the amount of fat that you eat, then you don't have any diarrhea, but yet you have substantial weight loss in the long term. So all 3 of these medical treatments are available, and we are able to work with you to work out which of these treatments is the right one for you. The new treatments are completely different to our traditional or previous approaches. Because in the past, what we used to do is we used to give people a diet or a treatment that made them lose weight, but at the same time made them hungry. So what we were doing is we were treating the signs of the disease of obesity, but not the symptoms of the disease. The new medical treatment allows us to do both. We make people lose weight, but at the same time, they feel less hungry, they're not thinking about food, and therefore the quality of life dramatically improves. The new medical treatments are much better than we've ever had. Now we are thinking that half of patients will lose 15% of their weight, and that's really 2 to 3 stone, while 1/3 of patients, 1 in 3, can actually achieve 20% weight loss. Now that's maybe 3 or 4 stone for many people. So that helps us to work out how we can use these medications best. It is important to say it is not the smart people who listen to us that lose a large amount of weight, or the people that don't listen or don't understand that don't lose weight. These medications work through biology, and that also alleviates people from the burden of worrying whether or not they are doing the right thing. We understand if these medications work, if it becomes easy for people to lose the weight and keep it off in the long term.